Hi, everybody, and welcome to our webinar this afternoon, our WHRTN webinar, Women's Health Research Translation Impact Network. And this is about the Health Research Hub, which is your one-stop shop for consumer and community involvement. I'd also like to start off by first acknowledging the traditional owners of the land upon which we meet today, the Wurundjeri and Wurrung people of the Kulin Nation. We acknowledge the Aboriginal and Torres Strait Islander people as the custodians of the lands on which we live, learn and work, and we pay our respects to their elders past, present and emerging. And we especially take this time to recognise and honour Indigenous women who are here, as well as those who have gone before us. And we look to their collective wisdom in guiding our work and seek continued partnership as we work together to improve health outcomes for all women living in this land. So without further ado, I'd actually like to introduce you today to our main speaker, Ashley Ng, who is a cherished colleague of mine and others here at WHRTN and MICRI. She's the Consumer and Community Involvement Project Manager and Research Fellow at Monash Partners and also at MICRI. And Ashley has been working on a huge body of work over this past year, culminating in a consumer one-stop shop hub. But I'm going to leave that up to Ashley to talk about a little bit later. But the actual project itself was funded by the NHMRC, and it's known as the CIRI project, and that stands for Consumer and Community Involvement Implementation Research for Impact. So rather than us always saying that long-winded phrase, we always call it the CIRI project. So without further ado, I would like to introduce you to Ashley, and Ashley, take it from here.
Thanks, Leslie. Thank you again for having me here to talk about this amazing project that I've had the honor of working on for the last almost 2 years now. So I'm going to tell you a little bit more about the project, which is, so Siri. If you have an iPhone, we've learned very early on that we had to deactivate our Siri because every time we said the project name, it just kept activating everyone's iPhone. But basically, I started with some background research and then focusing on the specific Health Research Hub as we've come to know it now, as well as a bit of future what's to come as well. So really, a lot of background work has gone into the development of this Health Research Hub. It started way back in 2018 with a national ARA, so the Australian Health Research Alliance survey, and a workshop on consumer and community involvement. And that was a really big national workshop where a big national survey that had over 868 responses. There was a one-day workshop, a national workshop, to really identify and prioritize the needs around consumer and community involvement. So back in 2018, consumer and community involvement was really an emerging space. And in this last few years, how much it has exploded has been amazing. So really, it prioritized that we really needed to develop minimum standards for good practice, sharing of existing resources and expertise, sponsorship projects related to consumer and community involvement, as well as formal alliance with some of the leading agencies to make sure that we're all working collaboratively and not in silos. And then in 2019, a piece of research was then done to look at what training requirements were needed to support consumer and community involvement. So this was through interviews and focus groups. So there were 28 interviews and 1 focus groups across healthcare improvement staff, so people working in health services, around quality improvement projects, as well as health and medical researchers as well. So we really wanted to understand how we can capacity build people who are looking to do consumer and community involvement and integrate that into their workplace and in their work as well. And then in 2020, there was a call for developing that knowledge hub and what that would look like. And so this was where that really initial groundwork was done through a survey, through co-design workshops, to just really refine some of the features and functions that people really wanted from this, so prioritizing those different things. And so the key themes that came out from that piece of work were the ability to connect people, accesses to resources and training, as well as accessibility and engagement. And so from there, the project, consumer and community involvement, Implementation Research for Impact, or C-Series, was born. We were funded by the MRFF. We were lucky enough to get a 2-year grant to do that. And overall, the big picture vision is to then see consumer and community involvement as key and at the heart and center in the operations of all the research bodies, and also sharing those key principles of, sharing of power, mutual trust, and shared belief in its value. So the aim of this massive piece of work is to generate the evidence base underpinning consumer and community involvement, and how can we then support its adoption and implementation across Australia through health and medical research, as well as healthcare improvement in health services as well. And really just to then improve the relevance and translation and health impact at the end of that too. So looking and zooming out at the really big picture, we're looking at a framework here. We've adopted the Learning Health System framework, where it's a bit of a continuous cycle where we draw evidence from different quadrants of a circle. So first up is really just the stakeholders. So really understanding who the key stakeholders are in this space, which has been confirmed through some of the background work that was done before, as well as going through that co-design process. So these principles were carried throughout the entire project. And then looking through the evidence in terms of what has already been done. So doing a scoping review on health networks and what's needed to help build them up, and what is needed to help make them sustainable and scalable as well as general knowledge and understanding around consumer and community involvement adoption, and then bringing all those evidence pieces together. So finding out, what is it in research, where are things currently at, and how can we then translate that into something practical. We then also looked at evidence within what's currently happening. So in terms of what are people currently doing through consumer and community involvement at the different workplaces, different organizations at a community level as well. We wanted to evaluate established networks around consumer and community involvement. What were the key things that helped them to build things up, and what helped them to maintain it as well. We drew from case studies. We looked at different policies that existed, and we also included the NHMRC consultation data we had earlier this year that was part of reshaping, or I guess improving and updating the consumer and community involvement statement as well with the Consumers Health Forum. So, and then with the implementation, we've got, once we've developed the Knowledge Hub, obviously evaluating that as well, and how can we then get organizations, individuals to adopt consumer and community involvement. So having different resources there, such as the hub, a toolkit, some training, through reports from what we've done, publications, and then evaluation of the whole project too. So that seems like a lot of work, and it is a lot of work. So if we broke that down a little bit more, you can see there are 2 key streams in terms of the project aims, and one is really to understand the individual level behaviours of consumer and community involvement, and the knowledge, attitudes, and beliefs of people. And that will help us to then facilitate the key messages for the Knowledge Hub to then support consumer and community involvement adoption. And then the next key area is really understanding what drives and builds consumer and community involvement networks, and how can we then, what are the main themes that come together to build that up? And so developing a bit of a framework around that as well. And all of those then result in having very practical tools to then help other people who want to adopt it, who want to change things for their own organization. So having those resources available for them, for you to basically use that. How we've done that through different data collection methods and tools. So we have done scoping review, lots of document analysis of field notes of different policies that have been used, structures, so organizational charts and things like that, how people set things up. There was semi-structured interviews that were conducted this time last year, actually. So that was a very fun period of time, speaking to a whole lot of people from a whole lot of different areas to understand what they were doing in consumer and community involvement and their perspectives on that. We also did a national mixed method survey, so that had close-ended questions, so where we can rank things and say a yes or no response, or have the ability to sort of share more thoughts as well. A lot of that then went into co-design focus groups and consultations. So lots of workshops that we've done, particularly to help develop the hub. And then when it comes to the evaluation and implementation, we'll be using a mixed method survey as well. So we're kind of somewhere towards that last bit of it all. And really, when we look at the key stakeholders, we've listed down there, we interviewed and surveyed research translation centres, so that's all the ARA centres around Australia, national funding bodies of peak organisations, so health peak bodies such as Diabetes Australia, Arthritis Australia, people like that, consumers and community representatives, health medical researchers, as well as clinicians and staff in healthcare improvement. So just to focus a little bit more on the network, so I highlighted that little section there. So really, when we're looking at developing a bit of a consumer and community involvement network, how we went about this was we did a scoping review. So we looked at all the different peer-reviewed published literature, as well as different grey literature that was there. So things like reports from organisations around the development and implementation of a network. We then evaluated and established consumer and community networks. So the Western Australian Health Translation Network Consumer and Community Involvement Program has an extensive and rather mature consumer and community involvement network. So we evaluated that to understand what was needed in order to build that and to sustain that model. And so we did that through interviews, focus groups, field notes, and some document analysis as well. We then did some semi-structured interviews with the research translation centres, so your ARA centres, as well as your health medical researchers, consumer community members, and staff and clinicians in healthcare improvement. So lots of interviews. And then we are currently analysing everything before we head out to do some co-design workshops to develop that final piece of network as well. So then we can have that framework, and really the purpose is then to understand, if someone was to come and say, we wanted to develop a network for consumer and community involvement for our own state or for our own region, here's something that is evidence-based in terms of what works and what doesn't, and how to keep it going and how to scale it up and how to evaluate it. We've got that toolkit kind of there ready for them to go. So that's one of the outputs that we're hoping to get or we're working towards. And the next one, which is the key big thing that I'll be talking about today, is that national digital hub. So how did we go about doing this? It was really, we did, again, the national survey. So we got 270 responses there, and a nice even mix, or a representative mix from, the different stakeholder groups, which you can see the consumers were the largest group there for feedback, healthcare improvement staff and clinicians, and health and medical researchers. And that theme kind of continued on with the interviews as well, where we saw a really good turnout or really good uptake of people who were keen to be interviewed for understanding the hub. So that also included the national funding bodies as well. Then once we've got to that, we got to a stage where we could sort of play with different things. We drafted some pictures and some, this is what the site could look like. We confirmed some of the ideas from previous work as well. And then we did co-design workshops and consultation. So we had 4 co-design workshops over, a period of a few months with a few changes in between. And we've just recently completed some prototype review as well. So we've got a clickable prototype that people can go in and click and sort of look at how things actually, how it all looks like and what that feels like, and the text as well. So getting all that feedback now, we're consolidating that and making updates before we kind of move it onto a live version. And then once we do that, we're going to have a little bit of a pilot evaluation. So a bit of a mixed method survey that we're hoping that it will go live in the next couple of weeks, hopefully before Christmas, and as well as getting some bigger workshops in the new year too. And so all of those different things will go into the Health Research Hub development. Even, the coming up with the name was quite a process and quite a very co-design process through lots of different areas to So there's no stone untouched when it comes to co-design with the hub, which is great. And so understandably, it has taken a little bit of time. And it's good because we now, it has really helped us to shape some of the key messages to include in the hub through the understanding of people's knowledge, attitudes, beliefs, barriers, and facilitators to consumer and community involvement. So by understanding all these different things, we can then use the right language to target people and say, this is how we would like to talk about this, and to give us the best chance there is so that people will come to the table and think that, yeah, consumer and community involvement is a valuable tool and not just something that they have to do. So I'll walk you through a little bit of that process in terms of what it looked like. So from the very get-go, there was a lot of mind mapping. This is what it could look like. This is where this content might go. These are some of the things we're thinking of. So it's very rudimentary. And then from there, our amazing user interface design and designers sort of came up with, this is what the page might look like. We might have a section up here. Here, this is what we're thinking in terms of, like, we're going to have a bit of a blocky mode, or we might have a bit of, we went through different iterations of what that could look like, where it even came down to like the shapes, like, do we want a square, type like segments, or do we want more like rounded ones? So all those little bits and pieces. So then we got to a space where it was a little bit more refined. There was color in there were pictures in there, a little bit more content. We then printed these static pages out onto giant pieces of paper, as you can see, and this is what we used for our co-design workshops. So in our co-design workshops, it was beautifully led by our lead design, so Leah and Suzanne. So what we did was we asked them to go nuts on the post-it notes and the texters and say, okay, put a green post-it note on things that you really like, and a red post-it note on things that you don't think worked. We started off doing that, and then we ended up going, well, first we ran out of different colored post-it notes, and so we started talking about, okay, what are the things that could be improved, and what do you think works, and what doesn't work, and why doesn't this flow, and what do you think if this was to happen? So there were lots of questions, lots of probing. And another way we went about getting people's perspectives was to develop personas as well. So you can see I've got an example here of one of our personas. So we would map Dr. Helen's journey out. So we would say that, Dr. Helen was a researcher who's looking to write a grant and include consumer and community involvement, but she doesn't know what to do. So we'll say that she's going through the hub, and what are the key pieces of information that she would need to get from that hub? How is she going to navigate that? What does she find useful, and how does she feel when she's done with it? In terms of, does she feel like she has enough information for her to go and write her grant now? Does she feel confident, or does she feel overwhelmed, and does she feel that this has not been very helpful at all? And what can we do to then change that based on the different, based on what we've got printed there in front of them? So that was a really beneficial journey for us to understand how people thought about different things and how people would navigate that, people's preferences as well. We had a lot of feedback around the images, the colors. I think at the start, even like, they didn't like the circles within the stock images and things like that. Oh, they were saying the colors were too bright. It looked like, a bank meets Cancer Council, for example. The colors were just too harsh, for example, when you printed them out. And so we took that all on board. And then the next iteration was, now we're at a clickable prototype. So with the clickable prototype, again, everything was then transformed to a digital platform. So it's almost like a little playpen where you could just click on different things and see how things work, but the whole site isn't live yet. So you won't be able to find it if you Google searched it. It's behind a private password protected, and it's still very much in developmental mode. So I've given you an example of what the hub looks like, and it's great that it actually looks quite similar to what we were playing in terms of a draft, because often what happens, which I've now come to learn, is that once you transfer some of these things onto the actual digital platform, some of the functionality and features disappear. And so you might get some very different things that pop up that we weren't expecting. So luckily we had things that were quite similar and we were able to work with those different things. And from here, we went through individual stakeholder consultants, individual, consultations with stakeholders to really have a deep dive into how they would navigate it, what they would click, what's intuitive to them, and how they would use the website. So looking at the navigation, looking at some of the content and the flow of the information that's going through. So we've just wrapped that up. We're still actually getting some more feedback coming through, which has been fantastic. And it's always good to see something in action, because you might have a whole bunch of text on a document, and how it actually looks when it's all done up in color live in front of you, you might get a very different vibe from it as well. So that's what we found. So at the moment, we're playing around with different things like icons and buttons and links. How do we showcase that? What do people prefer? Do they prefer having an image there? Do they prefer having a little button? Do they prefer having image, like little stories, for examples? So there's lots of different things, small things to consider that we may not have considered before, but every piece of feedback has been invaluable to date. And again, we've then used that persona again to draw out different perspectives of how people would navigate the site. So getting people to think beyond their own circumstances has been a very interesting way of extracting some of that information in terms of how you would do it versus how someone else would do it. Because a lot of people that we have engaged with have some sort of familiarity with consumer and community involvement. So getting them to think back to, back to the days where they didn't know what consumer and community involvement were, and they were starting from basically ground zero, was a very different experience for them. So they would say, actually, this might be quite overwhelming because there's just too much information on this page, or they might say this page is too text heavy, and I would read one paragraph and probably, just skim the rest of it. So it will then make us rethink how we're going to display and present the information. Do we need to have more images in there? Do we need to have videos in there? So that was a really worthwhile exercise as well. So what I'll do now is to basically run through some key areas of the site, and still keep in mind that, we are still very much developing this and taking on feedback. So there's lots of things that we're still working through. And what you see here will not be that final version that you will see at the end when it's all done and pretty and amazing. So, and all of this is based on all the research that we have done so far. So on the main page, what will feature is what we have heard from the interviews, the focus groups, the co-design workshops, was that they really wanted to see those three distinct, groups. So one specifically for consumers and community members, one for those who are doing health and medical research, and then a category for those that are involved in quality improvement in healthcare services. And so anyone can click through any of these things. The key feedback we got was that nothing should be locked to any specific stakeholders. Everyone should be able to access everything. And it was good from the perspective of sometimes consumers want to see what the researchers are seeing and vice versa, particularly for researchers who want to direct consumers to a particular resource, or just to see the type of information that they're receiving can be really helpful as well. And we also heard that there's a real need to have a central place for people to keep up to date about consumer and community involvement. So we've got the news and events page there, section, where you will get lots of different, what's the latest training events that are available around the state? Who are they for? You can then search them and filter them down to different stakeholders or to different states. Information's around consumer community involvement. So if there's any new grants coming out, things like that, any new wins for centres. What we also heard through, particularly the co-design workshops, was that we want people to leave the research hub feeling empowered and feeling positive about consumer and community involvement, not that it is some tedious thing that they have to do. So keeping the language light, keeping things bright and airy is really important. Also needs to be very, the language that we use needs to be very non-judgmental. So being very positive and being nice, essentially. And also what came through, particularly through researchers and clinicians who work in healthcare improvement, was to see some examples of how other people have implemented consumer and community involvement in different settings. So how have they done it if most of their work has been done in bench science? How do they do it if their work is in clinical settings? And how do they do it if, their work is in implementation science, for example, in clinical trials? So that was a key thing that we've tried to put through in the case studies, which were now called success stories. And I think that was a really nice change in that, one of the consumers said to us, like, we don't like the term case studies. It just sounds way too clinical. And if this website is supposed to be for everyone, I think success stories sounds a lot more positive and sounds more empowering. So we've changed that. And overall, I talked about the site needing to be quite warm and inviting. So we then also made sure that the color palette reflected that too. So we've kept the key colors that the RO branding has, but also introduced a few new ones too. Then, what else did the data tell us? So the data also told us that the language and how the content has been, how it will be presented is really important in terms of grabbing people. So what perspective they're written in, the information also needs to be really short and sweet with some calls to action. So making sure that it's not just a scroll of text. Information needs to be very practical. And so what we've tried to do is to have little snippets of that, have a high level summary, but then also provide people with more detail should they want to delve into things with more depth as well, if they need it for anything else. So we've got tailored content for different stakeholder groups there. And then next up, we've got curated resources. And this is something that we've heard time and time again from every single interview and survey. Was a really common theme, was that people wanted to know what are the key resources that they need to be referring to. And so this has already gone through a couple of iterations and still undergoing a couple of changes, was that there's so many resources when you actually go search up consumer and community involvement. So they just need to know that there's one place they can go to that has credible resources, but it's not a dump of all the resources that are there. So what we've done here is curated a few key resources that we think are really handy, and broken them down and grouped them according to different categories as well. So, whether they're guidelines or whether they are how do you support consumers once you've got them on board, to remuneration and reimbursement. That's something we get asked about all the time, is how do you do that? What are different ways of doing it? How does it affect Centrelink payments? All that kind of stuff. And then there is, so in our co-design workshops, we talked about things like, would you like images or just text when it came to presenting the resources? So you can see on the right, we've got different examples currently of what that would look like if it was just text versus just images.
Oh, hi, Ashley. I was just letting people know that you had frozen a little bit there. So
oh, sorry.
It's okay, not to worry. If you could back up just a tiny bit, you talked about supporting consumers and resources for consumers, and that you get asked about remuneration and reimbursement all the time. So whatever came after that, if you could just reiterate that, that would be fantastic. Thanks so much.
No problem. Sorry about that. So because we got asked a lot about remuneration and reimbursement, that it became in its own category. And so when we were doing the prototype testing, we wanted to get people's opinions of how it looked as well. So initially we just had a whole wall of different resources and people said that's too much, too overwhelming. So grouping them has helped, but also putting some images as well. So you can see on the right, we've got a few examples of presenting it in different ways so that people can tell us what they think would look better. And we always find that seeing it in person is a little bit different to trying to visualize that yourself. So we're still getting a lot of feedback around that as well. And the last bit of feedback was that, so the resources needed to be grouped in a very meaningful way to help make it as easy as possible to find information. I think what came up in a few of the co-design workshops was we're going to get a lot of researchers who have to write something about consumer and community involvement in the last minute. and I'm very guilty about this when I'm writing grants as well, is that I leave things to the last minute and I go, oh, what am I going to do now? So then you come across this website and you're hoping that this will be the answer to all your prayers. And you just want something really quick. You need to find your information really quick because you do not have time to be browsing through every single document, to be searching through, looking for that one line that you really need for your grant. And so having things that are easy to find is really key. So finally, opportunities to connect. And if you can remember, this came up through multiple different avenues, even from before we started developing the hub. This was a really big thing. And this is why we also focused on developing consumer and community involvement network frameworks as well, because the networks that we have for consumer and community involvement are key to help maintain and upskill in terms of what's currently happening in this space, what can we be doing better, what's currently best practice, and how can we improve our work. And so having opportunities to connect is really key. It's also another good opportunity for researchers and consumers to actually connect directly. So what we found, what we heard through the interviews were that consumers didn't have a platform to actually say, to search for researchers and say, I am interested in any research pertaining to MS, for example. I'm very keen to support any research that's related to that area, but I don't know how to search for them. I don't know how to reach out to them. And so this platform is that opportunity for them to do so. And vice versa, the number one question, apart from the reimbursement and remuneration, that we often hear from researchers are, where do I find consumers? And we've provided, a whole host of different ways and options to search for consumers, in terms of, you've got your typical reach out to your consumer organization, build your networks, really searching for, asking people who they can find, for example. So this will be another opportunity that we're hoping will grow with time, where researchers can share expressions of interest for their own projects, and then consumers will then respond to that directly. So we're still trying to build that up. We're still building it up in here. But it's also an opportunity for people to network with others, almost like a community practice. So they can talk about, I'm really struggling with, maintaining consumers and making sure that they keep coming back. Like, what am I doing wrong? Like, is there anything I could be improving? And people will have lots of different ideas and strategies. And then likewise, consumers can say, I'm searching for researchers, but I don't know where to go. Does anyone have any ideas? Or they might say, I'm in this situation where I feel like I might have a conflict of interest. What do you think I should do in this scenario? So it's just a really good opportunity for people to share and build on and capacity build each other up as well. So really what comes after this is a little bit of, not a little bit, but a lot of advocating for multi-level change across lots of different avenues. So if we're looking at, again, coming back to a framework, we're looking at the consolidated framework for implementation research, where we're kind of focusing on the different levels of the ecosystem, right? So you've got your outer settings, so your big policies, so your NHMRC, so the National Health and Medical Research Council, the Medical Research Future Funds that dictate sort of what you need to do in order to get those grant funding that you are applying for. And a lot of them have been mandating consumer and community involvement, so having to write that in. And we want that to be done meaningfully and not just as a tokenistic way. So how can we support that? And so by creating the evidence and generating the evidence there, we are providing people with a bit of the evidence-based support to say, yes, consumer and community involvement is important, is of value, and is effective. And then within the organizations, we've been supporting them through different reports that we've done, through the findings that we have analyzed as well as developing resources that will sit on the hub and for other organizations too, as well. Case study outputs too. So we have 4 case studies that are attached to this project, really focusing around working with communities, engaging them from the very start, and how do we do that. So these will be shared on the hub too. And obviously the hub itself is a key resource to upskill individual members to hopefully embed consumer and community involvement meaningfully in their work as well. So really the key question here that we want to answer is what are the roles and responsibilities that the stakeholders have across the whole system to then create this change. So it's almost trying to do this culture change across a whole like multi-system approach, which is fun, challenging but fun. So really the next steps are to evaluate the Knowledge Hub. So we're hoping that this will be kicked off in the next couple of weeks. So we've got lots of feedback that we're going through. We are making changes to the prototype as we go along, and getting that to a space where more people can kind of evaluate that. We can then keep refining it, throughout early next year. And we're really hoping to launch it, March, April next year as well. At the same time, we've got a whole bunch of data, as you can see. So we really want to translate those findings into very practical outputs for implementation, to advocate for more change and for more uptake, as well as for future opportunity and for future ways of upscaling the hub too. So really, I just wanted to leave you all with a question with, what will be helpful for you to help promote consumer and community involvement within your networks? And is that something that we can do and we can help you with through the Health Research Hub? And if so, please let us know, because then we would love to hear your ideas and see what we can then integrate within this next few months as a way of promoting the adoption of consumer and community involvement. And that is kind of it for me. So I'll hand it over to Leslie to field all the questions that are coming through.
Well, my goodness, Ashley, I am just gobsmacked with the amount of work that has gone into this in a much needed area, and it sounds like it's going to assist health improvement experts and researchers, and of course consumers, to capacity build and get this space dynamic, I think. And getting us all working together on the same page. It's just an extraordinary piece of work, and I commend you and your team for the work so far. It's just been amazing. So thank you so much. If anybody has any questions, please feel free to put them in the Q&A box, and I will read them accordingly. But I'd actually like to fire off a question to begin for you, and that is, this is such a vital piece. It's just a brilliant resource to have, and I hope that it doesn't become vulnerable to the point where we require funding, or we don't get recurring funding to actually keep it going. So I just wanted to know, how will it be maintained in the future once the funding is finished? Have you got any ideas on that?
Yeah, so this is a big question that we've been tackling from the very start, because sustainability of these projects is really important. What we often see in research is that once the funding finishes, the whole thing falls apart.
That's right.
And so we've been having broader discussions with the ARA Census, so the Australian Health Research Alliance, as well as the NHMRC, around, this is a much needed resource. There needs to be investment into it to help keep it going. And so I know Monash Partners will be taking on most of the maintenance in the next year or so, making sure that things are updated and up to scratch, as well as doing the back end things, because there's things like the discussion forum to be moderated. And that was a key thing that came out from the study, the interviews as well, was that, and the focus group was that no one wants to go into a rogue discussion forum, because who knows what would end up there.
That was actually one of my next questions, was about just that very thing, is moderating the discussion forum. Yeah.
So there is a little bit of human resource work that will go behind it. We anticipate there'll be a newsletter that will go out maybe quarterly as well. So we do need a coordinator to kind of manage those different things. And we're looking at different opportunities to fund it. But certainly I think ARA will be looking to provide some ongoing maintenance and support as well.
I note that one of the things you said was researchers are challenged often with two things, which is remuneration for consumers, and the other one was how do they find their consumers? So
Yeah.
how about I ask you that question, because you talked a lot about co-designing here.
Yeah.
So how did you find those consumers, and what was the makeup of your groups?
Yeah, so that's a really good question. So that's as part of our project, we put together a Monash Partners community advisory panel, and that we basically was piloting kind of what we think is best practice in terms of, we set up an expression of interest. We also reached out to community groups specifically to ensure diversity in members, and so what we've ended up with is a very culturally diverse group, which is fantastic. We've got people from non-English speaking backgrounds, from different life stages, different interest areas, which has been very refreshing, and everyone's so lovely to be working with. Everyone's got their own views, which is great. Everyone's not shy with their opinion, which is what we need. But it does take a lot of work, and we rely quite heavily on our networks that we have built up over the years. So Monash Partners has done a great job in terms of maintaining their networks with different community groups, as well as contacts. So our networks don't just include community members, they also include researchers who have their own networks of community members. And I think that's why there's such a huge focus and importance and emphasis on having good networks around you, because that's how you will get your consumers when the time comes to start involving them with different bits and pieces as well. And we've had fabulous a coordinator, Jo Ong, who kind of worked with that and made sure that they were getting reimbursed on time and remunerated on time, that they had adequate time for briefings, as well as understanding what was needed, and onboarding as well. So we made sure that there was some social time for that personal networking, but also capacity building as well.
Yeah. Ashley, I've got a question that's come in here, and it is a good one, and it's a loaded question, I do have to say, because terminologies change from area to area as well as country to country. But there is a question that says, what does consumer mean? I wonder if you can play around with that a little bit.
So consumer itself is a very contentious term, particularly within Australia, and it's in other parts of the world, they use patient and public involvement, and I'm not sure why in Australia, because we strive to be so different, we use consumer and community involvement. So we understand that the word consumer is very contentious within the community. It basically represents the public and people who are, I guess, health consumers, so people who are using health services or are likely to use health services, which is basically everyone. But it's also recognizing that different groups feel comfortable using different terminology, and we do acknowledge that. But because within Australia, consumer and community involvement seems to be the official term for now, we want to go with that to minimize that confusion, but we do understand and recognize that there are different terminologies that different groups and different sectors would prefer to use as well.
It's an interesting question, because whenever you try and come up with something that's different, you still end up being challenged. So even if you say patient and public involvement, everybody will be a patient at some stage, and you know, everybody's part of the public. You could say end user, but the interesting thing is that everybody is an end user, from your health clinician to your researcher. And indeed, especially in the research world, we can actually talk about end user, and some people will think a member of the public who's in a non-clinical or non-research position, but in actual fact, if you're co-designing, let's say, a digital health tool, for instance, your end user may very well be the clinician on the floor who's actually going to be accessing that digital tool that may not actually ever be seen or used by a member of the general public. So it's interesting how it's interchangeable, and I guess it's just like consumer involvement, whereby it's different expressions at different times for different projects, just like how we have different consumers for different projects at different times for different needs.
Yeah, absolutely. And that kind of just relate to that last question that's come through around, will the resources be applicable to any sort of consumer of health services? And there will be very specific, there'll be very generic ones that will be applicable to everybody that people can then tailor to their own use. But there are also some that we have shared that are specific to different areas. So we know that mental health are very well advanced in this area in consumer involvement and consumer engagement. We've got some resources from the cancer setting as well, and they're doing some really great work there. So it's really just a case of learning from different settings and seeing what's the best and choosing what works best for you and your organization and your projects, because we know that, and this is the tricky thing and the beautiful thing of consumer involvement, is that it's not a one size fits all.
No, that's exactly right. And it's almost the gray of the black and white, isn't it, in our area of consumer and community involvement, and we need to embrace it, that's for sure. And going back to one of the things that you actually said at the beginning, you were talking about, you mentioned the importance of understanding how to change systems and individual behavior. And I wondered if this tool, or the hub that you have created, will indeed help to do that. Do you want to talk to that a little bit more?
Yeah, so that's a really good question. And I think the hub in itself is one piece of the building block to help create change. On its own by itself, it's great for helping people to understand what consumer community involvement is, maybe provide a little bit more detail as to how to do it. But without changing the organizational infrastructure and support from the higher ups and the senior executive level, change isn't going to be achieved. And so it is just a small part of that bigger picture. And that's why we are developing other resources such as, the organizational toolkit, to help support organizations who are serious about consumer and community involvement and making that change, and providing some very practical strategies in terms of how they can best do that through different areas. And I think the biggest concern when it comes to change, everyone's afraid of change, it's just human nature, is that people think it's going to be quite resource intensive, it's going to be a lot of disgruntled people. But some of these things are very easy to achieve. So things like showcasing the good things that are already happening within your organization and making it part of your norm. Once you start normalizing that culture and normalizing involving consumers within the project from the very start all the way through, you start to get that change, and change does take time. So the hub is just one small part about across the whole bigger landscape as well.
It's a massive stepping stone. I mean, the amount of work that's gone into it so far, it's quite extraordinary. And I really do mean a massive stepping stone. I noticed there's another question. If we are doing more basic science exploratory research, how do you suggest we engage consumers? Example, it's not at the stage where the science can be translated to practice yet, but the NHMRC, etc., needs to have this part included in a grant. Would be great to obtain advice around this and where it may be appropriate. So what stage to include consumer involvement?
Yeah, and that's a great question, and one that we get quite often, particularly from those doing a lot of bench science, because there is such a big gap with what they're doing through to implementation science, where you're working with people every day. And so some really good examples of how I see bench scientists use consumer or engage consumers in their work is actually getting them to help understand and translate their research into layman's terms, because you're always going to have a little bit of that, writing and communicating your research to the public. How else are you going to get your participants for clinical trials down the track, or get people to actually understand what you're doing? Because it's, that's all that science communication is, trying to break that down into a terminology that people will understand. So for things that are quite at that discovery level, sometimes it might just be getting people to read through like participant information statements, or talking to them about the concept of what you're doing, and then getting their input in terms of if this was to go to plan, like what do you think are the barriers, and what do you think of this? And so consumer and community involvement doesn't have to be this whole interview stage or this massive focus group thing. It could just be a conversation and saying, we're thinking about doing this and we think this will have, do you think this will be a good impact, or do you think this will translate into something more? There are lots of different ways of doing that as well. So there are ways of doing it. It's just, yeah, you find it.
I could probably add to that too, Ashley. There's an emerging area, and indeed MICRI have done it, and the Women's Health Research Network have done it, and that is to have a dedicated person who actually is in-house, a consumer specialist who is in-house. And indeed, I hold that role within WHRTN and periodically with MICRI. That's one way of doing it, because the one thing about that role, and indeed people who work with that role, is that that person's responsible for building networks, which means that when grants come along, that person is linked into networks that might be pertinent to the piece of research, which then means you can actually get a fast turnaround participation in the grant writing. But the other thing too is, if you don't have that position in place, I was thinking that this is where relationship building, stakeholder relationship building, is enormously important for researchers, especially when we're saying that CCI needs to be at the forefront, or at least a major part of any research project.
Yeah.
And that is that if we are connected, if we are maintaining our relationships within community, we can actually call on those relationships from time to time for fast turnaround comment and or involvement in grants prior to actually receiving funding. So it's relationship building, as well as investing in certain positions that can help you do that. I think that's key as well.
Absolutely. And I think even from like putting on my consumer's hat for a second, I do a lot of consumer advocacy work for diabetes, and we've been involved in helping researchers to promote, I guess, in a sense, promote their benchtop research by talking about it and saying, this is what this research means to me, because if it does go through, it will help me in, prolonging or, delaying the effects of diabetes complications and things like that. And that's quite meaningful as well. So there's lots of different ways. I always have to be a bit creative. And there's in the Q&A section, there's some really good examples that have been shared as well.
Yeah, Penelope says the benchtop, even there, the research question is directly relevant to the people with lived experience, and often things like sample choice and collection can be better designed with the help of consumers.
Yeah, and I think there was I love this story. One of the interview participants I had, they were looking at collecting samples from children of, I think, parents with diabetes, and they said one of the samples they wanted to collect were teeth, to sort of look at the mineralization and things like that. But apparently it wasn't very well received by parents, because parents wanted to keep all of their children's teeth. So research was kind of like a no-go, because they couldn't actually collect the samples that they needed, and so they had to think of a different way of collecting samples. And even things like that could really change the course of how you actually do your research.
Yeah, so renegotiation with the tooth fairies.
There's another little collection.
Yeah. There's another question too here. Will you have this comes back to something that we were talking about previously. Will you have resources or strategies to encourage change of attitude? This is what I was talking about, change behavior. Change of attitude and behavior at the highest organizational level, so that senior staff can get on board too. That's such a good question. And I have to say that, is so relevant to the sharing of power, and that the dismantling of unnecessary power, I have to say, is absolutely necessary in order to bring consumers into a space where their involvement is meaningful, and that their existence is in partnership, not in a subordinate way. But perhaps you can talk to that too, Ashley. Do you have any ideas on that?
I mean, in terms of the resources on the hub that will help to address that, we will certainly be doing that in that organizational toolkit as well. So there'll be very high level strategies and ideas. But again, it's not, it's one part of the puzzle. So having strategies to help change people's behaviors is multifaceted. So having lots of different approaches at the one time is the key. So you can provide them with training till the cows come home, but if they don't actually care or believe it, then they're not going to have that change. But seeing that in action and actually talking to people and having those showcases all together might actually start to convince them. And that's actually what we've seen over the years working with different researchers, is that we've had some great stories of researchers across different levels. So bench scientists to senior researchers, understanding the value and benefit of consumer and community involvement, if anything at all, just to actually get grant funding, to acknowledge that it is important. And to do that, you have to actually do it well and meaningful rather than a tokenistic way, because people can sniff that out very easily these days. So we will have resources and strategies there, but we're also looking at opportunities to further out those strategies in terms of making them evidence-based and providing a more detailed toolkit as well.
That's fantastic. And we're blessed too that your NHMRC and your MRFF are behind this type of work and are looking to develop and advance CCI. So it's really good to have their support, that's for sure. What's next for the Hub in our final minutes before we wrap up?
What's next for the Hub? So we are looking at one of the key findings, one of the biggest findings from this project was that the ecosystem around consumer involvement for hospitals and health services versus health and medical research is quite different. So we are hoping to sort of look and flesh it out in a little bit more detail around how we can better support health services with consumer involvement, because often we hear from clinicians that they don't have time, it's very difficult to find consumers, it's not part of their role. They speak with patients every day, so they're already doing it. So it's trying to mirror and align some of those objectives together, and then supporting them as well. At the same time, better supporting researchers. And again, you mentioned having support from the MRFF and NHMRC. It's very much a collaborative approach. And very much a national collaborative approach, because we understand that doing things in silos is never going to work out for anyone, because we need more juicy brains coming together to make juicy resources and make culture change.
And also to produce research that's truly community relevant. Absolutely.
Exactly. And we've seen some of that in the comments. It's really important that the questions they ask is relevant to the community members at hand. Like they probably do not care about one little thing when they have other pressing social issues to combat. For example, they do not care about how many times you have to prick your fingers if they can't actually even access any of these technologies, for example. So it is going to be a huge change. And I think one of the comments is right, is, how do we get the leadership to then appropriately fund this? Well, there's not going to be much option out of it, to be honest. If this is what we truly believe in terms of the benefits to the community and making sure that what we do is relevant and impactful, then this is the way. Like, I don't understand why not that I don't understand why it's so difficult, but it is the right thing to do, in that sense that we are doing this for the community, and if we want to really generate that impact, making sure everything that we do is relevant, making the best use of our government's money and our taxpayers' money, then this kind of makes sense.
Great. That's great, Ashley. I just want to mention too that Amy has put a couple of resources in the Q&A section of this webinar at the moment. The other thing too is that this webinar will be available next week on YouTube. And there was one other thing that about the survey.
Yes, so a reminder to complete the evaluations, as they're really important as to inform future webinars.
Yeah, absolutely. And it's really helpful to get that feedback. On behalf of Wharton, Ashley, I just want to thank you so much, not only for your presentation today, but for the work that you and your team have put in so far. It's extraordinary, and it will help advance CCI in the research and health improvement space. So thank you so much. Thank you to everybody for joining us today. Have a great day. And if you have any other questions, please send them to Ashley or myself, and we can continue the conversation.
Thank you
so much, Ashley. Take care.
Bye.